Fox 45 Morning News. All local, all morning.
When you hear the word acne, well, most of us immediately think of the teenage years. But acne affects adults too, even adults who never had acne as a teen. But how do you treat it, especially when most treatments are for ages of teenagers? Dr. Sanjiv Saini, owner of MD Dermatology of Maryland, is here with all those answers. Thank you so much for coming in, Doctor.
Absolutely. It's a pleasure to be here.
Sure. Now, it's one of those things where you really don't hear about it, but I'm getting reports, I was reading about it, that up to 30% of men and 20% of women actually suffer from adult acne later on.
Oh, absolutely. There's so many people in our practice who've come in 35 years old, and that's their first breakout they've had of acne. Most people will have some breakout in their teenage years, and then they'll have a flare in their later years, but that is very common. I've been on medicine before. I've been on Accutane twice, once at 39, once at 42.
Okay.
So it's one medicine that's very good to use. There are a couple of different regimens.
That's a very strong dose, though, of medicine, but there's other, I guess, procedures out there that you can start off before you start going to the bigger one. Okay.
Absolutely. Oftentimes, topical benzoyl peroxide washes are great for men because then they don't need to apply something. I'm a guy, so I don't like to put a cream on my face if I don't have to. But creams, benzoyl peroxides are excellent because they're anti-inflammatory. The product line that we actually modified and used in our office is developed for East Coast weather because a lot of the major products that are made, one of the major brands out there that I won't mention is developed for California weather. Well, it's warm all the time. Maryland, we've got 20-degree weather. In the wintertime, we've got very harsh, dry winters. So we actually modified our product line to accommodate for that, as well as very hot, muggy summers.
Region-specific on the
Absolutely.
medication. I had no idea. Now I know there's other options as well. I mean, there's lasers that you can use for it. Tell me a little bit about that.
Absolutely. There's light-based treatments that are out there now for acne. In my office, my own staff, there's blue light, there's lasers, there's intense pulse light. All of these are light-based treatments. Without getting into the technical, what is the difference between them, they all work. And they all have amazing results. One of my own staff, she had free treatments with intense pulse light treatment, and for months she's had wonderful improvement. I mean, if you saw the pictures, it's truly stunning.
Okay.
And the thing is, the other option also is low-dose antibiotics that can be used. Okay. I'm not a fan of antibiotics for long-term use because of the resistance that can occur.
But that brings up a good question, though. How long does a treatment take to last? I know that you were talking about from the lasers to prescription pills to antibiotics and everything. How long does it take? Is it a couple months turnaround, or is it a lifelong?
It can be, depending on the treatment, it's individualized for person to person. Okay. You mentioned Accutane being a very heavy-duty drug. Yes, it is. In order to go on it, you need to go on a federal registry, and it's the one that we reserve for maybe just a handful of patients each year because of the fact it has so many potential side effects. But it will do things no other medicine can do. Okay. The light-based treatments I've really been impressed by because they've given months and months and months of improvement. Okay. And then the daily regimen, they all work hand in hand with each other. All of these complement each other, and individualizing a therapy is where...
That's where you come in.
That's right.
That's exactly why we are the professionals there. Thank you so much for coming in. And Dr. Sanjiv Saini from MD Dermatologist of Maryland.
Absolutely.
We appreciate all of your expertise.
You got it right also.
Hey, all right. Well, there you go. Even better. Coming up in our 8 o'clock hour.